Hello, hope you're enjoying your day. This is a short video I created that kind of shares with the mindset that I have when I'm analyzing a nose and then correlating that to some of the techniques I use to create an outcome. Hope you enjoy it. Hi, today I thought I'd try something a little different, and instead of just showing a pre-op, post-op patient, I would do a little analysis. This lovely young patient wanted a smoother, more symmetrical nose on the front. This is a pre-op picture, and then you can see these contour lines are quite uneven. The middle of the nose is sort of pinched, the upper nose toward the bones are wide, and the tip is a bit wide. And here she is 2 months after surgery, still a little swollen, but these aesthetic lines are much more uniform and straight. On some of her other angles, you can see in her base view. This view is not so critical in and of itself cosmetically, but it's very informative as to why the tip looks broad. She has a base sort of the shape of a rounded square rather than this nice rounded triangle which she has now. And that makes all the difference in how the nose highlights and shadows in a way that's more flattering. On her profile view, you can see that she had a small bump on her bridge and the tip was a little bit more projected than she would have liked. So the tip was brought back, the bridge smooth, so she has this nice balanced, feminine, soft relationship. The angle is more of a normal angle from the upper lip, and the nose has a smooth contour. And it's on these 3/4 views that you can see that some of her features are a bit stronger. On her right 3/4 view, you see the bump, and then you really see the tip sticking out. There's a second contour here, which is the cartilage on the right. This is the contour of the cartilage on the left. With a post-op change, it's more uniform and smoother. And she didn't want an overly narrow or small nose. She wanted still to retain a strong nose that fit her features and that she identified with. Here on the opposite 3/4 view, the nose looks a little different, a bit smoother, but still quite round at the bridge and the tip a little bit rounded at the bottom. So for her to make the changes, an open structure rhinoplasty was performed. This shows the anatomy. There was some reduction along the bridge of the nose, taking away some of the top of the septal cartilage and bridge cartilages. There was some cartilage taken from the part of the septum internally and used to create cartilage grafts to add that smoothness and strength to the middle vault of the nose. There was a cartilage graft between the two tip cartilages. This is a septal extension graft that provides support so that the tip can be anchored onto the graft. And with that, I could set the tip slightly closer to the face and slightly higher. And the final step was to create definition and shape along the sides of the tip cartilages. That again was done structurally with these lateral coil strut grafts to create that triangular base instead of that square base. And through a combination of it all, we have an outcome where she's still a work in progress because she's still swollen. But just seeing her today at 2 months, she's very happy, which of course is the most important thing.